Treatment of fibroid. The treatment of fibroids depends on the severity of symptoms, the size and location of the fibroids, and whether a woman wants to become pregnant in the future. Treatment options include watchful waiting. If fibroids are small and not causing any symptoms, your healthcare provider may recommend simply monitoring them for any changes. Medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, or hormonal contraceptives can help manage pain and bleeding associated with fibroids. Gonadotropin-releasing hormone, GnRH, agonists can also be used to shrink fibroids, but they are not recommended for long-term use due to side effects. Agonists are medications that can be used to temporarily shrink fibroids by reducing the production of estrogen and progesterone in the body. How it alleviates symptoms such as heavy menstrual bleeding and pelvic pain. Once the medication is stopped, fibroids may regrow and symptoms may return. These hormones are known to stimulate the growth of fibroids. GnRH agonists are used for a short period of time, typically no more than 6 months, because long-term use is associated with side effects such as hot flashes, vaginal dryness, and bone loss. It is important to discuss the risks and benefits of GnRH agonists with your healthcare provider to determine if they are an appropriate treatment option for you. GnRH are not recommended for women who are trying to become pregnant, as they cause temporary infertility, also women with certain medical conditions, such as osteoporosis or certain types of cancer. GnRH agonists work by suppressing the production of hormones from the pituitary gland, which in turn reduces the production of estrogen and progesterone by the ovaries. Uterine fibroid embolization (UF). UF is a minimally invasive procedure that blocks blood flow to the fibroids, causing them to shrink and die. During UF, a thin tube called a catheter is inserted through a small incision in the groin and guided to the uterine artery using X-ray imaging. Small particles are then injected through the catheter to block the blood supply to the fibroids, causing them to shrink and die. UF is a safe and effective alternative to surgery for many women with fibroids. The procedure is typically performed under local anesthesia, and most women can return to their normal activities within a few days. UF has been shown to be effective in reducing the size of fibroids and improving associated symptoms such as heavy menstrual bleeding and pelvic pain. UF is not recommended for women who are pregnant or who have uterine cancer. There is also a risk of complications with UF, such as infection, bleeding, and damage to surrounding organs. It is important to discuss the risks and benefits of UF with your healthcare provider to determine if it is an appropriate treatment option for you. Myomectomy. Myomectomy is a surgical procedure that involves the removal of fibroids from the uterus while leaving the uterus intact. It is a good option for women who want to preserve their fertility and have fibroids that are causing significant symptoms. There are several types of myomectomy procedures, including hysteroscopic myomectomy, removal of small fibroids through the vagina, abdominal myomectomy, removal of fibroids through a larger incision in the abdomen, laparoscopic myomectomy, removal of fibroids through small incisions in the abdomen. Myomectomy is generally associated with a shorter recovery time than a hysterectomy, but it may not be effective in treating all fibroids, and there is a risk of fibroid recurrence. Hysterectomy. Hysterectomy is a surgical procedure that involves the removal of the uterus, and it is considered a definitive treatment for fibroids. It is typically recommended for women who have completed their family or do not want to have children in the future. Hysterectomy can be performed through various approaches, including abdominal, laparoscopic, and vaginal approaches. Recovery time after a hysterectomy may be longer than after a myomectomy, but the procedure offers a permanent solution to fibroids and associated symptoms. The choice of treatment depends on various factors and should be made in consultation with your healthcare provider. Thank you for watching. Kindly subscribe for more videos.